One of the most common questions that I get from so many viewers here is how much zinc is it okay to take? What's the kind of threshold? Like, am I taking too much zinc? So these are really common questions about a very popular and critical mineral that we need to be consuming every day, but we also need it in the right balance. And I'm going to share with you the different nuances of taking zinc, what are the forms that I recommend, as well as the dosing to help support your immune system and keep you healthy and well. So let's talk about zinc. Zinc is something, especially now, we're dealing with a lot of folks that are concerned about their immune state, want to bolster their immune system to be responsive to colds and the flu and even COVID. So zinc is something that a lot of people are taking, but they're not sure if they're taking the right form. They're not sure if they're taking too much or too little. And they're not sure if they're maybe offsetting or creating symptoms because of taking zinc. And so I want to cover all of that. And one of the things as a naturopath, zinc is a really critical asset to our immune system. And it can be utilized if we utilize it in the right way, we can actually maximize the potency of zinc. And I'm going to talk to you a little bit about zinc microdosing. That's how I like to recommend utilizing zinc. And that also ensures that we don't hit certain thresholds that put us into what I consider zinc toxicity. Okay, so let's talk about zinc and the assorted forms. There are a lot of different ways to get zinc into our body. You're going to find supplementation, like for instance, the Immunity 3 we have here at Organixx. This has two types of zinc. It's zinc arginate and zinc glycinate or zinc glycinate. Kind of depends on how you want to say it. But those are two forms. We also have zinc chelated zincs. We have zinc that we find in trace mineral forms and liquid form. We also will see like things like zinc oxide. That's often we know that as the zinc we put on our skin, but actually we can see that in supplementation. I don't advise that at all, a zinc oxide. So if you are consuming any type of zinc in that category, I would switch to a more bioavailable form, which leads me to talk about the forms that we want to be consuming. Zinc is a really unique mineral. It on its own cannot actively and successfully enter into our body and our cells for max absorption. And we call max absorption bioavailability. So zinc forms that you want to look towards for max bioavailability are going to be zinc that is paired up with what we call a transporter. And we often will see transporter be an amino acid. That's the most common. And so, for instance, in the Immunity 3, this is a supplement I love to recommend for folks that want to lift their immune state, that want to grab zinc and get it in the right form, and that also want to be able to microdose in a healthy way. This has camu, and it also has elderberry, all very healthy for our immune system. But what's critical here is the zincs. There's a zinc arginate and a zinc glycinate. And those two zincs have amino acids that are connected to them. So the amino acid becomes a transporter. It brings in the delivery, and it's a delivery method, brings in zinc to the cells, and then we see that transportation process happen. The amino acid moves away, and voila, we have zinc integrated into our body. So Immunity 3 is what I recommend for awesome zinc, but you can get that in also trace mineral form, and you can find liquid forms. But most critically is you want to look for a transporter. Now, if there isn't a zinc that is bound to an amino acid, sometimes we will see a supplement added into the mix. So for instance, a supplement that has curcumin would be a very helpful zinc transporter. So there are some herbal compounds that can help max the absorption and maximize the bioavailability. So I just want to kind of clear that up. But zinc plus arginine and zinc plus glycine, those are two very powerful forms that integrate into your body. Now, as far as delivery methods, the transporters are helpful at bringing the zinc into the body. But how do we take a supplement, and what's the most kind of effective way to look at a zinc? Well, before I get into that, I want to share with you where we look at kind of the daily, weekly, and monthly max thresholds for zinc. And a lot of this has been studied, that's in the medical literature. that every day we kind of want to see our daily zinc intake at about 15 milligrams. That's the daily required dose. That's what you're going to see on a lot of like supplement facts. They'll, they have the daily value or a recommended daily dosage. You'll see that on supplements. And it's okay to extend beyond that for a certain period of time. And that's where we get into microdosing. But 100 milligrams every day for a sequence of days, weeks, and months, we're at that threshold where we're getting into zinc at levels that are not going to be equally balanced within the body. The max threshold is 300 milligrams of zinc, which is extensive. And honestly, you'd have to be taking a lot of zinc, and it would be overwhelming to your body. You might even get some of the symptoms before you hit that. So usually we're going to see that 100 milligram threshold where people get symptoms of extensive nausea. They will have changes in their cholesterol levels. It leads to additional stomach upset, headaches, dizziness, even sometimes it's this weird kind of scenario, like the spine, they kind of have like a wobbly spine. So there are symptoms that we look for that kind of max zinc. But what I recommend is to make sure, this is my cautionary tale, when we are taking more than 15 milligrams of zinc a day, which is very common. I have a lot of patients when I work with them, we'll set out all the different products that they're taking. So they might be taking, like an elderberry gummy. They might be taking a liquid kind of throat soother. They might be sucking on a lozenge that has zinc. Well, all of those zincs are going to add up. And so I like to have us kind of calculate how much zinc are you getting in your multivitamin? How much zinc is in your protein smoothie powder? Sometimes zinc is going to find its way in food additives. We're going to see it in some protein bars. We're going to see it in a lot of different places that we don't always think about and register. Plus, we also are going to get zinc from our food, our plant-based sources. So once we kind of gather that kind of collective quantity of zinc, and you can very easily add this up, what I recommend then is looking at, are you hitting that threshold? And if you are, and you're not taking a zinc balancer, we need to add that in. So let's talk about the zinc balancer. The direct balance, counterbalance to zinc is copper. And this is a lesser talked about and discussed mineral that we need to have in our body to balance out zinc. And one of the most common forms of copper deficiency from a kind of upper levels of zinc is premature gray hair. So if you have graying hair, where you've noticed like you're on a kind of, cold flu regimen, you're trying to support your immune system, and you're taking every day 75 milligrams of zinc, and you've been doing that for 6 months, and you've noticed like you're having a little bit more gray hair, or even other parts of your body, you're noticing graying hairs. And we have graying hairs all over our body. If you're noticing that, and the only thing that has changed is your immune supportive supplementation, then we need to add a copper to balance that out. So that is really, really important. And I mention that because zinc is not negative. It's very powerful and it has positive effects on our body. But the way the body, the symbiotic nature and the homeostasis that our body is always trying to achieve, it's all about balance. And so if we add more of one thing, we need to counterbalance it with another. And so that is, I'm hoping, super helpful in understanding how much zinc you want to aim for a day. And then let's talk a little bit about microdosing, because I want to highlight, for instance, if you are taking the Immunity 3 here at Organixx, one, calculate the other zincs that you're taking. So I want to make sure that we're staying below 50 and 75 milligrams on a daily basis. If you are just getting your zinc from Immunity 3, awesome. If you notice that you start to feel a kind of ick coming on, then you can start microdosing the Immunity 3 because of the zinc. You can microdose and take 2 capsules every 2 to 3 hours, up to 3 doses that day. So that is how I recommend ensuring that we're not going beyond, you are not hitting and going beyond the 100 milligram threshold every day. That 100 milligrams, close to it, and everybody's body is a little variant in terms of how they react, but that tends to be where we see a lot of those symptoms. we'll see the nausea, the headaches, the weird kind of wonky imbalance in the lower hip and spine. And we also will notice different imbalances when we're pulling mineral profiles. And I do blood testing with patients. They'll have really low copper, super high zinc, and a lot of the symptoms we're combating, it ends up being because we need to lower the zinc dosage. And so there are a lot of different ways to do that. And I can get into that in future videos, but I just wanted to share with you the most important takeaways of how much zinc, what's too much, and really how to utilize some of the amazing benefits that we offer you here in Immunity 3 with the 2 most bioavailable transported forms of zinc. So let us know how that works. And I'm curious, for all of you who start calculating your zinc, I'd love to know if we have an average of zinc and the milligram dosage that you're often finding you're taking. I'd love to find out how we can also support balancing the zinc here through some other organics products. So make sure you comment and let us know.